Hi, everyone. This is the It Takes a Village series. I'm Dr. Carrie, and we have...
I'm Dr. Michelle.
And?
Hi, I'm Amy Rieselman. I'm an acupuncturist and herbalist in Naperville.
Awesome. So tell us a little bit, kind of delve into that for us, Amy.
So I have been practicing in the Lyle, Naperville area for the past 15 years. I specialize in women's health as well as digestion, which of course is all related. My practice, it's a family practice focusing on women, anywhere from preconception, infertility issues, pregnancy. People come to me during pregnancy, postpartum, and I also work with menstrual disorders and perimenopause and menopausal symptoms and issues as well.
Right. So yeah, you run the whole gamut.
Yeah. I know it's kind of all related because it's all okay. The way I do it, it's just really holistic. So nothing is unrelated, really. When you get down to it, including digestion. So I'll see constipation, diarrhea, whether it's their primary concern or secondary. A lot of times, a patient comes in with a primary concern, and then that gets resolved, and then now something else comes up because it was not their main issue, but it's always been there, and then that becomes the main issue when the other thing has kind of been resolved. So
that sounds familiar.
Yeah, exactly. Yeah, you guys see the thing, I know.
Yeah, and I love it. It's just from a different angle, and I think it's worth noting that you don't just do acupuncture. You're an herbalist, like you mentioned in the beginning, which is huge because you're able to make formulations, and they can just get it all done together.
I do herbs is different from a lot of people I know in the area that are practicing, and just that I do customized herbs. So instead of taking 3 bottles of pills, 3 times a day, I give you 1 bottle of granular formula, meaning you mix it with hot water and you take it as a liquid, as a hot tea. That way you're not getting too much, extra things, because we all have, in my opinion, we all have taxed livers, and everything we take in goes through the liver. So we want to minimize, the things that we're taking that aren't healthy foods, because everything you take into your body, as you tell your patient, either good for you, bad for you, or neutral, right? So you got to see everything is medicine that you put in your mouth, right? So I really like to customize herbs, and then we do it in stages too. So I'm working with the pulses in Chinese medicine. We use some of us use pulse diagnosis, and that helps me hone in on what's going on inside your body. I can see there's different pulses. So there's the left wrist here. There's 3 different positions, 3 different levels. And then there's plus 3 more on this side, each with 3 different levels. So what's that? 6 plus 6 is 12. So there's about 12 pulses that I'm analyzing, and that helps me see what's going on in the body. Where's the imbalance? Where's there too much, blockage? Where's there deficiency? So that's a lot of what I'm looking at when I'm using pulses to diagnose. So Chinese herbs is internal medicine. Acupuncture is complementary to that, and it works with blockages in our energy meridians, which has been proven over time. I don't know, acupuncture at least 2000. These energy pathways exist, and know how to find and release the blockages with acupuncture. Yeah.
That's great. That's a lot of good info there. I mean, I know all women, all women in our different stages could use support, and it's not just about nutrition, but it's just making sure, in your case, you look at how the liver is processing everything, and we're looking at how the nervous system is able to effectively communicate with things like the liver and the hormone organs out there. And it just all ties in, and everyone's in a different phase, and people need to know what they can also be doing and tap into.
Yeah, chiropractic and acupuncture are extremely complementary. So I prefer my patients to have chiropractic care, because that way they're getting, all the angles. Because structure and that nerve flow is so important, and I can't adjust, obviously. So
you wouldn't want me to do what you do, so it's perfect. Yeah.
So but they are very complementary. And so as far as pregnancy, pre-pregnancy care, so making sure your cycles are regular so you can get pregnant naturally. Supporting artificial reproductive therapy, or assisted reproductive therapy, I should call it. Enhancing the outcomes of that. And then during pregnancy, you should be comfortable. You know, people think, oh, being pregnant, I just have to be uncomfortable. No, you should have a vibrant, healthy, feel-good pregnancy. It's a very healthy time of life. So if you have pain, you know, get care. If you have digestive upset, get care. If you're nauseous, etc. What other things we see? Anxiety, I'll say, you know, might get heightened during pregnancy. And that needs to be taken care of too, because it's all going towards a healthy, normal birth, right? We want the birth to go smoothly. We want baby to be born without trauma. So that's what we're working towards. And the outcomes, I know you see the outcomes, I see the outcomes. It's definitely worth investing in prenatal care.
You also have a protocol. There's certain things you do when moms present with breech presentation, correct? Like there's certain things that you'll...
Yeah, it's super effective. I don't think anyone knows why, but it works. It's actually incredible. Well, there's one channel in the body called the bladder meridian, and it starts in the corner of the eye and ends on the pinky toe, believe it or not, right by the pinky toenail. So it's a really important channel. It traverses the entire backside of the body, wraps the head, goes along the spine in two columns, right up along the spine, and then another column outside the spine. It goes all through the sacrum. So, you know, sciatic pain, etc. It's all related to bladder meridian. But yes, we use that. We use the point on the pinky toe, and we use moxibustion, and that's been very effective for most of my patients, along with some acupuncture care as well. And yeah, it's definitely worth worth going for that, because it's so much easier than having abdominal surgery if you can avoid it.
Yeah, I know. We usually try to send our moms that come in with breech presentation, we'll use our Webster technique. We'll refer them out to you or somebody that does that, because yeah, like putting those two together really kind of gets better outcomes for those mamas.
Yeah, I had a patient recently who was referred to me by a midwife group, and her doctor, she came to me, we were doing it, he wasn't turning. Her doctor's like, we have to do an ECV, external cephalic version, right? Didn't turn, didn't work. More moxa, you know, more care with me, and that baby turned. He just took his sweet time, but it worked, you know. I was like, wow, this is taking a little bit longer than the other babies, but hey, you know, if it works.
Everybody's different. Yeah.
Long before he's born.
Right.
Yeah, all about creating that ideal environment, you know, because the baby's going to do what the baby's going to do, but you want to give them every chance possible to engage and do what they need to do. I guess if you would say, what would be some of the top reasons why, I mean, I know you went into more detail, but what are like the hot button kind of conditions that you're seeing right now between like digestion and just women's health? What would you say are your like top three?
Sometimes I'll get a bunch of hot flash patients, you know, hot flashes, insomnia, with menopause. Okay. So that's, you know, I get good results with that. That's not something you should have to live with, and hormone replacement therapy is not really an ideal solution for many people. It doesn't either doesn't help people, or it can cause other problems in the future. Let's see what else. So, I mean, really the pregnancy patients I see, it's a wide variety of things are coming in with the things I mentioned. Endometriosis is something that, you know, I can really help with, both with the pain and just improving the actual quality of the blood flow. Because acupuncture is, you know, all about pain. We're all about, you know, releasing blockages, which releases pain or diminishes pain. What else am I seeing right now? Yeah, I mean, a variety of digestive things. I have a patient with a really rare condition. I think there's been like 60 cases since 1989. I mean, really rare. But, you know, after a couple of days, they'd be like, oh my gosh, I was painful, you know. So just healing the digestive other things that I've been seeing lately. Trying to think. Yeah, anxiety, neck pain, of course. Different kinds of abdominal pain.
Awesome. Yeah.
PCOS, actually, yeah, PCOS also. Another hormone imbalance. So.
Yeah.
Yeah.
What would you say to someone who's like deathly afraid of needles? Because I'm sure you've heard that.
Yes, glad you brought that up because, yeah, people say, oh, I can't stand needles. Oh, no, no, no. Well, I think everyone is thinking about syringes when they think about needles. We all get vaccines as kids, or most of us did. And I think that that's a traumatic event for kids, and then it kind of sticks with you and creates kind of like a PTSD, I think. And people getting blood draws, you know, a doctor's taking a syringe directly into a vein. So it's painful, and it can cause trauma for people psychologically or otherwise. Especially if you've had an instance where, you know, that somebody missed your vein and they're poking you. So I think people have that in mind, and acupuncture is completely different. Our needles are so thin, they're maybe the width of maybe 2 human hairs, if that, maybe 1.5 human hairs, or even the same width as a thick hair. So it's really tiny, disposable, one-time use, and I'm not going for your veins or arteries. It's really kind of sliding into the tissue. A lot of times people don't feel them going in, and you might feel a zing for 1 or 2 seconds, and then it goes away. A little bit of sensation, I wouldn't call it pain. Sometimes it can be a little bit strong. If there's a lot of blockage at a point, you'll feel a strong sensation, maybe 1 or 2 seconds. But yeah, definitely way different than what people think about when they think about needles. So that's what I try and explain. I'm like, oh, you know, let's just try it. And they love it because you feel so relaxed when they're in, because it actually puts you into a healing state. Your brain waves change. Kind of like the state between when you're awake and sleeping, where, you know, your body's doing things in the background. And so you're just relaxed because you're not active at that time with thinking. So it's very relaxing. And nowadays, I think relaxation is half the battle.
Yeah.
People need to slow down. People don't even realize how revved up they are. They don't even realize, because it's normal, you know? So, and you tell your patients, you need to be able to have that downtime, let the nervous system do its thing. And so I think acupuncture is a great way to do that. And then the results of acupuncture last, you know, and they create longer and longer effects. The more treatments you have, you know, they start lasting longer and longer, to the point where my patients start coming in once a month, once every month and a half, just for maintenance, just to keep everything flowing well, keep you relaxed, keep your body remembering, yes, I know how to relax. And that's beneficial for people.
Great. Yeah,
Awesome.
that was so good.
Stuff. Well, yeah, I think, any other questions?
No, I think you got it all. I think, you know, everyone should definitely consider it. And as we know, health is an investment. You know, it's kind of like, you know, people who avidly work out. It's like, well, you're only going to work out as long as you want to be healthy and strong, you know, and so it does take some effort. And I think just people being aware of the resources that are out there is step 1. Step 2 is like, you need to do it.
Yeah.
You know, we're not doing it to have people come in, you know, twice a week forever. No, there's a treatment plan that we put you on, you know, and we want to see you get better. We want to see you out there living your life. And I think that what you do and what I do, I think gives people that, you know. Sometimes upfront it's an investment. You have to commit the time, you have to commit to taking the herbs, and you have to commit to coming in. Yeah. So, but it's so worth it. I mean, it just blows me away all the time, the results, you know, like, you feel that better already, and you had that problem for how long, you know? So it's fun for me. So
Yeah. Same.
Yeah.
it's like, wow,
Well,
after 15 years, still getting amazed. It's fun.
that's a good thing. Well, thank you for jumping on this call with us, Amy. We appreciate you being on.
Thank you so much.
Bye.
We'll talk soon.